Hello and welcome to another edition of Medical Today. I'm Gerard Ratnam. Of course, this program is brought to you in conjunction with a collaboration put together by Ramsay, Sime, Darby Healthcare and also Pharmaniaga, coming together to give you as much information as we can and to try to simplify all that jargon that's flying around in the medical world. And when you talk about the medical world, we're always a part of the medical world because we always seek medical advice or medical attention. That aside, in our show today, or on the show today, we'll be talking about neurosurgery and what that means. We'll also be looking at some very funny words like oculoplastics. Do you know what that is? If you don't, stay with us. We'll be giving you the 411 on that as we move along on today's edition of Medical Today. But as usual, in our first segment, we're always joined by someone in Pharmaniaga. And to join us once again on the show is Vanessa Daniel, the Deputy General Manager for Clinical Affairs. She's also a pharmacist, a pharmacologist, and she's from Pharmaniaga Berhad, joining us today to talk about pharmacovigilance. That's pharmacovigilance. What's that mean? Hi, Vanessa, thank you very much for joining us on the show. It's a pleasure to have you here once again. The last time you were here, we were talking about medications, but last time around was about safety of medications, something to that effect, right?
Cosmetics.
Cosmetics, yeah.
Cosmetics,
Safety
yeah.
with cosmetics and also some cosmetics kind of cross into medications. Am I right? Am I not right here?
Okay, so safety of drugs and safety of cosmetics both are important to the users, but how they are managed slightly different.
Right.
Okay.
So the management of it is slightly different. So when we move into today's topic, pharmacovigilance, what's that mean? You know, to simplify this, being vigilant about stuff from the pharmacy.
Okay, that's a big word, pharmacovigilance. So to make it really simple, it basically means drug safety. Okay. So what do we do in drug safety? What's it about? So drug safety is really everybody's responsibility. We have patients, we have doctors, we have the government, we have drug manufacturers all working together to collect information, to review this information and then spread awareness about the side effects of drugs and how to best manage it and to not be so afraid of it.
Now, in Malaysia, when you talk about statistics or collating information, how do we do it in Malaysia? Do we have a different way of doing it as it's done overseas, say in the Western world or in other Asian countries? Okay,
so we have a huge database of drug safety information being collected from every country, and they have a monitoring center where they look at all this drug safety information, they analyze it and determine whether this is real information and good enough or not good enough, important enough to be spread, for the awareness to be spread to health practitioners and also patients. So yes, to answer your question, yes, there is a global database for this.
Right. So when we look at drugs, like you said, cosmetics and drugs, the way you deal with it is different. Even with drugs, there's prescription drugs, there's over-the-counter drugs. Yeah. Any difference with these two branches of drugs?
Okay. Over-the-counter drugs, you don't need a prescription to buy them. You can just go to your pharmacist, buy the drugs. Prescription drugs, you need a doctor to prescribe it to you. But both have drug safety awarenesses that we need to spread. Okay. both have side effects. There's no such thing as, oh, it's an over-the-counter drug, there's not going to be any side effects. There will be.
Right.
Okay.
When you talk about side effects over the counter, let's take paracetamol, for instance.
Okay.
There's so many myths flying out there as to how bad it is for your kidneys, so on and so forth. I'm sure you heard this. So there must be some form of control with regards to even over-the-counter drugs in it.
Yes. So we can't control what goes about virally on the internet or through WhatsApp messages. Okay. But what I would do if I was a patient or a paracetamol user would be to first read the package insert. Now, when we go to pharmacies and buy those nicely packaged...
Hang on, we know package inserts as paper in the dustbin.
Yes, that's right. So you go to the pharmacy, you buy those nice, beautiful boxes, you open up, you get this nice little piece of paper which you conveniently dispose. You don't even read it. Okay, but you know, that piece of information, that piece of paper has so much information that you can use, okay, mainly on the side effects. So let's say that piece of paper has got 70 side effects listed. It doesn't mean you're going to get all the 70 side effects. You may get one, you may not even get one. But the important thing is that you read it and you are able to identify, if you do get one, what are you supposed to do? Do you panic? Well, obviously not. You shouldn't panic.
Right.
But at least you know that, okay, this is a side effect. I need to see my doctor, or you know what to do once you have it.
Right. Now, with side effects of medication, when you see a doctor, okay, he gives you 3 or 4 different pills, even if it's for, say, a simple cold and a fever.
Yeah.
Right. Do you need an explanation as to how each and every one works? I mean, we go to our doctors, we take it for granted. They give us medication, we take it, we go home. We're talking about going to your normal clinics around your housing areas, or your primary, what do you call it, healthcare provider, to get what you need when you're not well. And we take it for granted that, you know, whatever they're giving us, all we need to do is just take it as requested without understanding, getting more understanding about it. Is it being too pernickety if we want to know more about these?
No, of course not, because you're the patient. You know, I would think that it's really important for you to educate yourself on what you're taking. Responsibility also lies with you. Okay, so you know, we don't always stick to one doctor. We always go to clinic A, B, C in the span of 6 months. Okay,
what, doctor shopping?
Yeah, something like that.
I love that.
Okay, and you know, these doctors probably don't have your medical records for the last 3 months. Okay, so what I would do would be to make sure when I visit a doctor to make a list of the medications I've taken for the last 3 months. Let your doctor know, so he knows that when he prescribes a medicine for you, he knows what you've been on and what you are on. This is especially important for those of them who are on long-term medications like diabetic medications, hypertension medications. You want to tell your doctor, you know what, doc, I'm on these medications. Do you think what you're prescribing for me could give me a side effect because I'm on other medications? It's important to tell your doctor that.
Right. Now, for those of us who are wondering what's happening with regards to different doctors, say some of us, to give you a simple example, some of us work within the city, but we live outside the city. So where we live, naturally, there'll be a healthcare provider of some sort that we go to.
Sure.
Now, where we work at in the city, if you're not well, you're going to go to one of the doctors around you or panel clinic. And it's always good to give them information as to what you're taking.
Absolutely, yes.
Right.
It's always important to let your doctor know information that he may not have about you. Okay, this is to help him treat you in the best possible way.
Of the areas we were talking about this, and you did talk about listing down your medication. Not many of us do that, have a list of the medications we take. So when we list, put a list of medications we are on, when we talk about these medications, or when we put it down to as information for a doctor, what do we need to put down in there? Because there's a brand name and there's also the generic brand name sometimes. What do we need to put in the list?
I think if you, for a lay person, if you're not used to looking at an active ingredient of a drug, and these kind of words may be a little bit daunting for somebody to write down. Sometimes you don't even know how to spell the drug properly. just get the name, any name, you know, either the label name, the brand name, the active name, anything. I think the doctor is trained enough, he will know.
Right. Now, taking medication, there's take before, after, and with meals. Can you explain this to us?
Okay.
I get lost when you say with meals. I don't quite understand. Yeah.
Okay. So you can take a medicine before meal or after your meal. Okay. Some drugs actually work better without the presence of food. They get absorbed better. They affect your body a lot better. Some drugs work better when they are taken with food. So it really depends. Again, this is where you need to look at your label or the leaflet, the package insert. It will tell you whether to take before food or after food. But at the end of the day, let's say for some people, they may have problems like gastritis.
Right.
And for these kind of people, maybe the situation is you can't take drugs and on empty stomach. Could be your health condition. This you can speak to your doctor and say, you know what, doctor, I have this condition. Can I actually take this drug before food? Is that a problem for me? He'll find a way to, you know, change the dose for you.
We've got about 40 seconds left. Very quickly, this 10 minutes is gone. What's your advice on side effects with medication?
Okay, I think besides listening to your doctor, don't mix medications, don't self-medicate. Okay, that's wrong. That's really wrong.
Why are you smiling when you say this?
Okay, that's one. Number two, ask your doctor if you need to make lifestyle changes. You know, some medications can actually, some foods can cause your medicines to not work, like grapefruit. Okay, or you may experience sensitivity to sunlight if you take certain types of medications. Do you need to stay off the sun? You could experience weight gain or weight loss. Maybe change your exercise regime. You know, there are a lot of things that you can change, that you can do to your lifestyle to reduce the occurrence of side effects. Ask your doctor.
Right. With that, we'd like to thank Vanessa for coming in. Vanessa Daniel, the Deputy General Manager for Clinical Affairs / Pharmacologist for Pharmaniaga Berhad, joining us to talk about pharmacovigilance. Stay with us. We'll be back after a short break right here on Medical Today, Bernama News Channel.
அரசியல், பொருளாதாரம், சமூகவியல், அறிவியல், விளையாட்டு, கலை, இலக்கியம், அனைத்துலக செய்தி என உடனுக்குடன் தகவல்களை கொண்டு வருகிறோம். புதிய பொலிவோடு, புதிய நம்பிக்கையோடு பர்னாமா தமிழ் செய்திகள். பர்னாமா அலைவரிசையில் மட்டுமே.
The Nation, a talk show from the Current Affairs desk with in-depth conversations on health, women, property, theatre and performing arts. Only on the Nama News Channel.
Hello Malaysia and welcome back to Medical Today. As promised, we're going to find out what neurosurgery is all about. To talk about neurosurgical conditions or problems, we have with us two very experienced doctors, Dr. Azmin Kas Rosman, a consultant neurosurgeon from Ramsay Sime Darby Healthcare, and also Dr. Liu Bun Singh, who's a consultant neurosurgeon, also from Ramsay Sime Darby Healthcare, joining us on Medical Today. I'm honored to be here joined by two neurosurgeons. Thank you very much, gentlemen, for coming in. Now, I guess the most simplest and the basic of questions for people like us lay people, is what is neurosurgery? Maybe, Dr. Azmin, you can start with your take on what neurosurgery is.
Thank you, Gerard, for the invitation and the opportunity to explain something about neurosurgery. Neurosurgery is a discipline within medicine, and it entails the treatment, the diagnosis and the treatment of neurosurgical problems of the patient. Mm-hmm. So what we do is, for the patient, we diagnose if the patient have based on the signs and symptoms of the patient, and then we do the investigations of the patient, and based on the investigation of the patient, we will do the appropriate treatment, mm-hmm. whether it's medical treatment or surgical treatment.
Right. Because we have two of you here who are neurosurgeons today, I think the better question to find out is, why did you take up this area of specialty? Maybe, Doc, you can walk us through that, why you picked up neurosurgery as your area of specialty.
At first, neurosurgery is quite interesting because it treats the system that involve the whole body mm-hmm. system. It's not specific to certain region of body, and we could actually put them either in the brain or spine, or even in any nerve in the body, where we call them as a peripheral nerve.
Right.
And this nerve is some form of transmitting some electrical activities which control the system of the body in terms of immunity of the body, the function of the body, both motor function, the movement, mm-hmm. the sense, the sensory, and also the organ function of the whole body, including the heart.
Mm-hmm. Now, I think, coming back to you, Dr. Azmin, I think this makes it that more complicated because it involves the whole body. Now, is neurosurgery confined to any specific body part when you talk about body parts?
Well, the most important part of the central nervous system is the brain, and you have the peripheral nervous system. Mm-hmm. This is the nervous system consists of the central nervous
yes. system and the peripheral
yes,
nervous
which
system.
Is the brain. This mm-hmm. If you can see, this is the brain, and then you have the spinal cord, which runs from the brain right down to the back of the patient.
Okay, so this is the spinal cord.
Yes. Mm-hmm. So this is the spinal cord, and this is where the head is.
Right.
And you have the spinal cord, this yellow part of the structure, which runs right down to the back. Mm-hmm. And then you also have the peripheral nervous system, which are the fine nerves all around the body. Yeah. And you have also autonomic nervous system. These are the nervous system which controls the heart and the abdomen and the gut. But essentially, most of the time, the neurosurgeons are concerned with the central nervous, the brain, mm-hmm. and the spinal cord.
Right. But when you talk about neurosurgery, is neurosurgery limited to any specific group age? Now, I'll move to you, Dr. Liu.
Yeah, neurosurgeon, we do treat patients of all ages, from the time they're even in the intrauterine period before their birth, up to the person who are at their golden ages. And the treatment depending on diseases. At different ages, a patient would presented to a neurosurgeon with different spectrum of diseases and disorder. And they usually need specific investigation and specific treatment, surgical treatment according to their age and the diseases that they're presenting at.
So it'll be very interesting to now find out how a patient or someone who needs a neurosurgery comes to you by means of coming through their primary health care. What can happen with a person at a primary healthcare level, where it's ascertained by their primary physicians that they need to see a specialist and then a neurosurgeon? What kind of diseases do you treat, basically?
Because neurosurgery can involve from a newborn right to the golden age of a particular patient. It happens even during pregnancy. Mm-hmm. During pregnancy, if the mother, for example, is noted to have a very enlarged abdomen due to the pregnancy, then they should do an investigation why the girth is bigger. So sometimes certain conditions of the brain or the spinal cord can give rise to such a condition for the mother. Mm-hmm. So an appropriate investigation, like an ultrasound, has to be done, and a consultation with the neurosurgeon should be done. And normally, if we find that the head is too big for the child to be delivered, normally by spontaneous vaginal delivery, then the child has to be delivered by cesarean. Normally, in such cases, patients normally have problems with their spinal cord or their brain, and this may be due to multifactorial causes. Could be genetic causes, especially if one of the families have such a problem as this, and sometimes it's also due to the food diet for the mother.
Mm-hmm. Dr. Liu, would you like to add to this? We're talking about diseases or disorders that affects pregnant women or newborn babies.
Yeah, the most common presentation to a neurosurgeon in a newborn baby is a big head, where we term in medical term as a hydrocephalus. It simply means there's an excessive accumulation of brain water or cerebrospinal fluid within the head of the patient. Again, as what been explained by Dr. Azmin, is usually due to the structural abnormalities during the pregnancy itself, and a lot of time people have related it to a low folic acid in the diet, which usually affecting in low income and medium income.
By and large, this is when a neurosurgeon steps in to sort the problem out. Now, when we talk about children or newborns, let's talk about kids who are a little bigger. Let's talk about teenagers and young adults. What kind of diseases afflict them?
Yeah, unfortunately, in Malaysia, most of the teenagers and the young adults are involved in motor vehicle road traffic accidents. So they have a lot of trauma cases. We have an abundance of trauma, and they come with a severe head injury, and the severe head injury takes a long time to recover. I mean, you can have an accident. An accident can happen within a split of a second, but it takes months and years to recover. That
includes sports injuries too.
Exactly. Yeah. Mm-hmm. So normally, in such a patient, when the patient comes into the hospital, they have to undergo sometimes, depending on the investigation, they have a huge clot in their brain which has to be removed, and the brain will not be able to return to its normal self within a short time, and it takes months, or it may never come back to its normal self. So sometimes the patient will have severe weakness, weakness of the legs and the hands, and inability to talk, and the patient will be on, sometimes they have to open up the throat. So I think prevention is very important. I mean, trauma is very, very serious in Malaysia, road traffic accidents, and I think everybody has to be careful in their lifestyle.
Right, Dr. Liu, when you talk about trauma, and when you see a patient with internal bleeding within the brain, can you sort of tell if the patient's going to pull through and brain activity is going to come back to normal? Can it be told in the early stages?
Yeah, definitely yes. And most important for those patients with acute trauma, the investigation that carry out should be immediate, where we term them as golden hours. The earlier diagnosis was made, and the earliest assessment can be made to a particular patient, and that will help us in terms of accelerate the surgical treatment. Those patients who need a surgical treatment are usually, we can see from the conscious level. Usually they are in a poorer conscious level or in a severe form of injury. Sometimes they may have some neurological sign that can be detected, for example, unequal pupil size and or abnormal movement of the limb. Those are important signs we look at, and we need to correlate those findings with imaging findings and to tell us what form of surgical treatment may be indicated in those cases.
Right, so ascertaining and looking at treatment options all comes in the golden hours, yeah? The first few hours after trauma. Well, I'll tell you what, we'll take a short break and we'll come back. When we come back, these two gentlemen are going to walk us through a little bit more of neurosurgery right here on Medical Day. Stay with us. Gain insights from the people with the capacity to translate vision into reality. Interviews with corporate leaders at 8:30 p.m. Monday, only on BNC.
"9/11" menampilkan pelbagai segmen menarik khas buat anda. Saksikan 9/11 setiap Isnin hingga Jumaat 9 pagi. Hanya di Bernama News Channel.
Hello and welcome back to Medical Today. We're currently discussing neurosurgery or getting a simple understanding of what neurosurgery is. I'm joined by the men in black. No, I'm joined by two very established doctors, Dr. Azmin Kas Rosman, a consultant neurosurgeon. Also joining us is Dr. Liu Boon Singh, who is a consultant neurosurgeon, both from Ramsay, Sime, Darby Healthcare. Now, we're talking about problems with regards to accidents, trauma to the head. This always happens with sports people. Just the bad driving and riding we do in Malaysia also accounts for a lot of that. When it comes to adults, there's an added component to it. As you were talking to me or giving me some information off the airwaves, you were saying that adults have an added what do you call it? Trauma, which is psychological trauma. Can you walk us through this?
Especially in Malaysia, and the people who are riding motorcycles, they are very young age group, the teenagers, and also and sometimes they could be the family breadwinner. So if they are involved in an accident, they are unable to provide for the family, and the family is an immediate stress on the immediate family and the relatives. Right. And on top of that, the company is also affected, and the government is also affected, because for treatment for a patient with severe head injury, it would amount to about 30,000 to 100,000.
Right. That's in 30,000 to 100,000. That's in public healthcare.
Yes.
Public and private both. So that's a lot of money. Now, I guess the bulk of your work is explaining to families before you carry out the surgery. You need to explain to families what's going to happen. And of course, when you're dealing with a brain, it's added stress to a family. Now, when you talk to families, you've got a bad case at hand or on hand, and you need to do something about it, but there's a 50-50 risk. How do you explain this to families?
Yeah, this is quite difficult, especially at the beginning of my career as a neurosurgeon. But over the time, we must, to be able to convince the family, a surgical is a must in certain cases. Right. Some cases we may need some form of monitoring in those patients. But the understanding about the injury, especially the primary injury, which happened during the accident itself, is very important. And what we are doing now, at the second stage, we call it prevention of secondary brain injury in the form of surgical, by evacuation of a blood clot in the spine or in the cranial, intracranial component, optimize oxygenation, ventilation of patient to prevent secondary injury. And definitely at time of injury, it's very hard for us to prognosticate whether a patient will recover from it. But based on our observation, usually young patients, we tend to do better than elderly. Having said that, in trauma, there's no age limitation in terms of treatment.
But of course, in younger people, it's easier because recuperation is better and faster. Yes, so you see results a little faster. Now, when you talk about work done by a neurosurgeon, the scope of work by a neurosurgeon, what sort of spine diseases or disorders are managed by neurosurgeons?
For neurosurgery, we have people who are subspecializing in pediatric neurosurgery, and you have the ones who are just doing general and spine surgery. So in the ones who are doing pediatric neurosurgery, they operate and they come across are patients who have spinal defects actually. So these are the patients who are born with congenital spine defects, and the spine maybe have no abnormal skin, and just the spinal cord may be just open, and as such, the neurosurgeon has to repair this defect. And as you move up into the age group, then you come across patients with trauma. So you have people who have from road traffic accidents who have fractures of the spine, and that would require decompression to alleviate the problems, because when they have a fracture of the spine, it may compress on the spinal cord. So you have to make sure that the spinal cord is good, is not compressed, and you have to stabilize the bone because of the fracture. And sometimes, even if there is no trauma, patients develop discus hernia. So that's when the disc comes out from this normal alignment, and it compresses on the spinal roots. So in such cases, the neurosurgeons would have to remove the disc. And normally these operations are done under microscope, or it could even be done under endoscopic techniques. And later on, in the older age group, sometimes you have even tumors of the spinal cord, and you have degeneration of the bones, and leading to spinal stenosis, which you require decompression, so that, because as you get older, sometimes the canal of the spinal cord gets smaller and smaller. So as such, you have to give space for the spinal canal to.
Right. I think one of the bigger problems for a neurosurgeon would be an infected nervous system. Would that be a big problem? When you set out to do a surgery, you find out there's an infection, what happens then?
Yeah, infection we have to be very meticulous actually. I think most neurosurgeons they have some mild form of obsessive compulsive disorder, I think.
And do you have OCD?
Not so.
And I think we are very particular and meticulous in the sterility of the field or what we're operating. So everything we re-sterilize and make the operation site very aseptic. Yeah.
Now, Dr. Liu, coming back to you, let's talk about those with seizures or epilepsy. Can they be treated by a neurosurgeon?
Yeah, definitely neurosurgery have a huge role and responsibility in treating a patient with epilepsy, especially those with a focal epileptogenic lesion in the brain or which causing a refractory form of epilepsy. What I mean by refractory means is the condition or the seizure cannot be controlled by medication per se. And to carry out this task, we actually need to do a quite thorough investigation to look at the zone that causes seizure, and this usually in a younger age group, in a teenager with a late presentation of seizure. And those investigations will be able to let us pinpoint the seizure point, the focus that causing seizure, and we can treat by surgical means by resecting area that is causing seizure, or sometimes we can do a disconnection between different fibers that causing seizure in a patient. The other form of treatment, we can even go to put a stimulator, we call it vagus nerve stimulation, in controlling the seizure.
Now, we've discussed quite a bit in this couple of segments that we have. When you look at neurosurgery, are there any rarities in patients that a neurosurgeon would treat?
In Malaysia, what we commonly treat, of course, we have the trauma, but we also have a lot of strokes. So the strokes that we come across here are mostly due to the infarcts, where there's lack of blood going to the brain. So this part of the brain sometimes have no oxygenation to the brain. So what happens is that they have a kind of swelling. So it may require a neurosurgeon's advice and treatment to relieve the pressure.
The stressed area,
Yes.
which is swollen. Yeah.
And sometimes you need to revascularize the blood vessels to establish a new vasculature for the brain.
Speaking of revascularization, how successful is it these days?
Most of the time it's been done a lot in Japan and in Korea, because some diseases are more prevalent there in Japan and Korea, and I think it's quite the results have been quite good actually, because we have new technology to assist, and there's new techniques, microscopes and microsurgical techniques, which helps to improve the outcome of the operation.
Now that we've talked about the nitty-gritty of what a neurosurgeon does, some very simple questions in the next couple of remaining minutes with regards to experience. Does an experienced neurosurgeon make a difference? You know, when you start off as a neurosurgeon and as you move on, does experience make your work better?
Yes, I think I've started neurosurgery in 1988, and when I was young, I used to be very edgy in the operation theatre. I used to be very stressed out, so I expect everything to be very proper and perfect. Yeah.
Because of your OCD.
Yes, and I think, and as I grow up, when you get older, because I have to teach, and we have to teach the nurses and the neurosurgeons and the master students and our trainees. So I think we tend to be a bit more calm, and because we know if they have a complication in the operation, we know what to expect and we know how to handle it. Because when we're young, sometimes we get stressed out. We don't know how to handle this, but as you grow older, you become more confident, and I think you realize that sometimes even in operation, it does not depend completely on your capability or your experience. It depends a lot on God as well.
Right.
I think God makes the executive decision.
Dr. Liu, would you agree with what he's saying?
Yeah, definitely agree. And one important point that we need to understand is even a patient presented with the same diseases, but the flow of the treatment, even surgical treatment, may be differ from one patient to the others. And a lot of times that what we learn from the textbook is something a common man could have, but in reality there's so many variation intraoperatively in each individual patient, and that makes experience an important factor in the training, in the practice of neurosurgery.
Right. Yeah. So the difference in individuality can make so much of a difference within these surgery.
Yes,
right?
Definitely.
Yep. On that note, we'd like to thank both of you, Dr. Azmin Kasrosman and Dr. Liu Boon Singh, consultant neurosurgeons from Ramsay, Sime, Darby Healthcare, joining us right here on Medical Today, giving us an insight as to what they do professionally, which is neurosurgery. Thank you very much, gentlemen.
Thank you very much, Garrett.
Stay with us. We're going to take a short break and come back with more for you on today's edition of Medical Today, right here on BNC.
Laporan berbagai dimensi memaparkan isu semasa, rancangan, warisan dan budaya dari dalam dan luar negara. Saksikan jurnal bernama News Channel, semuanya tentang anda.
Hello and welcome back to the final segment of Medical Today. Now, what we're going to talk about involves a lot of pronunciation work. So we're going to look at something called Oculoplastics. Now, what is that all about? To tell us more about that area of speciality, we have Dr. Nazila Binti Ahmad Azli. She's a consultant ophthalmologist and oculoplastic lacrimal and orbital surgeon from Ramsay, Sime, Darby Healthcare. That was a mouthful, but we'll find out what it is. Doc, thank you very much for joining us. Thank you for taking time off your busy schedule to be with us. Now, just to give us an overview of what oculoplastics are, can you walk us through what this is?
Thank you for having me here. Oculoplastic surgery is one of the subspecialties in the field of ophthalmology. It basically deals with the plastic, reconstructive and aesthetic surgery of the eyelid, okay, the tear system or the lacrimal system, the orbit or the eye socket, the upper face and also the mid face.
So what kind of patients do you see, or what are the common cases do you see in your area or subspecialty?
When we talk about oculoplastic surgery, I suppose the main bulk of our work would be the eyelid. Okay, so the eyelid cases comprise about 75 to 80% of the whole workload, and followed by lacrimal system diseases, that would account for probably 10 to 15%. And the least would be the orbital cases.
Right. So what kind of eyelid problems would be referred to you?
Okay.
Now, who does the referral work?
Okay. The eyelid cases that oculoplastic surgeons deal with, okay, there is a wide variety of eyelid cases. We deal with all age group, okay, the pediatric age group and also the adult population. I would say the common cases would be things like eyelid malposition. Okay, they come to you with probably eyelid disorders like ptosis. Ptosis is actually a condition whereby there's droopy eyelid. Okay, it can happen in pediatric age group since birth, and it can also happen in the adult population due to various causes. And other than that, a patient may come to you with problems like outward turning of the eyelid. So, okay, we call it ectropion, or interning eyelid. Okay, we call entropion, and loose skin or redundant skin of the upper eyelid or lower eyelids, or the better known as eye bags. Okay, and for the pediatric age group, they can also present with lid abnormalities such as failure of fusion of the eyelids, we call coloboma, and it's also common to have ptosis since birth. Okay, and apart from that, eyelid conditions would be that of infection, inflammation, eyelid tumors such as the benign growth of the eyelids and also malignant cases, and not forgetting eyelid trauma,
right.
Okay, from various causes.
With the bulk of patients you see, where in all the different types of surgeries you do, what's the most commonest in Malaysia?
You mean in terms of surgery?
In terms of surgery.
The commonest, I would say, well, I wouldn't say, eyelid basically.
Okay, let's break it down a little bit more. Let's bring it down to children. When you see children, what are the common problems with Malaysian children?
Ptosis.
Ptosis.
Droopy lids.
Right. So these are droopy lids, and how do you fix them?
Okay, droopy lids in children, they are normally, the cause is usually due to the maldevelopment of the levator muscles, or the muscle that is responsible to open up, okay, the eyelid retractors. So when there is maldevelopment, the function is usually very poor. So what we need to do, we need to rectify this problem by doing surgery to actually suspend the brow, okay, or frontally sling, we call it, whereby we use synthetic materials, or we can also harvest fascia lata from the thigh to become the material to bring up the lid, so that children can have a better view and to prevent further complications.
So essentially, with droopy eyelids, what's happening?
Okay, with droopy eyelids, okay, it can cause blurring of vision. Okay, in children, it's very important because we have this critical age period whereby there shouldn't be any obstruction to the vision. Okay, so when there is droopy eyelids, they tend to it can either totally obstruct the vision, or it can obstruct the vision partially. All right. So when they obstruct the vision partially, the eyelid can cause glare or astigmatism, and when this happens, it's like having a refractive error. Okay. So when this happens, the affected eye will become lazy if not treated. Okay.
Right. Now, with droopy eyelids, I understand that adults have droopy eyelids too. Now, with children and adults having droopy eyelids, is the problem different when it comes to treating it or helping the person?
Yeah, it's very important to distinguish between these two because the management is totally different. In adults, normally the levator function, the function of the muscle is good. Okay, so we don't actually need to use synthetic material or to use fascia lata from the thigh to fix the problem, but the surgery would normally be that of tightening the muscles,
Right.
rather than fixing it with synthetic material.
Now, there's other problems that you also handle, which is a lacrimal or tear system. Can you tell us about how what you do to help people with problems with the tear system?
Yeah. First of all, we need to establish the diagnosis by doing simple tests in the clinic, apart from the clinical examination. So, if at all, I mean, the usual cases would be that of nasolacrimal duct obstruction or tear duct obstruction. And if patient anatomically or has this kind of problem, surgery would be the only treatment.
Right.
Yeah. And if, let's say,
So when you
as
said
a result,
if a patient is anatomically having this problem, which means that there's something wrong with the system.
yes,
Right.
there is usually an obstruction, narrowing or a stricture that's causing tears to flow freely from the eye to the nose and to the throat. Okay, so if this happens, then of course surgery is the answer to it. But before embarking on the surgery, these patients, they normally come with recurrent infections. So when there is recurrent infections, they need to be treated with antibiotics.
So you treat them with antibiotics first, deal with the infections, and then work on surgery.
Yeah, but not everybody would have this kind of infection, even though they have nasolacrimal duct obstruction, depending on the degree of the obstruction.
Right. From there, just one or two more questions with regards to the eye. Now we're going to talk about cases or problems that can affect the orbit or eye socket. Can you walk us through these problems that we have with regards to the orbit or the eye socket?
Okay. The orbit or the eye socket is actually the bony walls, okay, that encase the globe, the eyeball, the muscles, the fat, that's surrounding the muscles. So there are many pathologies that can arise from the orbit. The common would be inflammation, common ones, like inflammation, orbital infection, okay, like orbital cellulitis. Orbital tumor can also arise from the orbit, and it can be either benign or malignant. And if you happen to have surgeries, if you happen to have fractures of the face, okay, facial area, most of the time the orbit will be involved as well.
Right.
So when there is orbital fractures, so we deal with it.
So most always they're usually trauma patients that come in with these problems.
Yeah.
When there are fractures involved.
Yes.
Yeah. Well, I do understand that in your area of specialty, there's an offer for patients who are blind or have deformed eyes. What can be done to help these people?
Okay, yeah. Normally for these people, there are two categories. Okay, one would be those blind and deformed eye. The other one would be that of having painful blind eyes. Okay, so in order to alleviate this problem, what we normally offer is that we would remove surgically the intraocular content or the eyeball content of the patient, and we replace it with an orbital implant, from synthetic material, to replace the volume. And the outer coating of the eye, okay, the eyeball, which we call sclera, is modified to cover up the orbital implant.
Right.
And after 6 weeks of surgery, we would normally put an ocular prosthesis or artificial eye. And this is usually made, usually custom made. Okay, you can customize it according to the fellow eye, and patient will look perfect after that.
Fantastic. With that, of course, Dr. Nazila, it's been a pleasure having you in the studio to walk us through or give us an overview as to what oculoplastics are right here on a Medical Today. If you do have any questions for all the professionals that we had on board on this episode, all you need to do is send us an email, send it to ask or ask@medicaltoday.my. Furnish us with your question. We're going to send you the answers, but we'll also do you one better. We'll send you a bottle of vitamins courtesy of Pharmaniaga. On that note, on behalf of the Medical Today team, I'm Gerard Ratnam signing off. You have a great weekend and a fantastic week ahead. Thank you very much, Doc. It was a pleasure having you.
Thank you.